Welcome back to Strada International Conference on Health. Now we will jump to the main agenda that will be panel discussion with the previous speakers. But before that, we have to take, I will read the speaker. The first speaker is Dr. Yu-Hsuan Chang from Taiwan. And then the second one is Mrs. Shwu from Taiwan. And then the third one is Mrs. Tzu-Yu Chen from Taiwan. The discussion will be led and hosted by Mrs. Eva Agustina Yalestiarini as Cup Nurse MCUP. And before we start the first symposium, let me read the curriculum vitae from Mrs. Eva Agustina Yalestiarini. She was born in Kediri, August 12, 1982, and graduated Master of Nursing from Gajah Mada University, Yogyakarta. She was a nurse at Baptist Hospital Kediri in 2006 until 2009, and she has the experience as lecturer at Ganesha Husada Health Science School Kediri in 2009 until 2015. Now she is being the lecturer in Institute of Health Science Strada, Indonesia. This is the summary of Mrs. Eva curriculum vitae, which I can read. Also, there are still many interesting and proud achievements that she has achieved. And please welcome to Mrs. Eva Agustina Yalestiarini as Governess MK.
Yeah. Thank you for the opportunity, Mrs. Arina, that has given to me. Before we start our session, first I would like to say Assalamualaikum warahmatullahi wabarakatuh. Good morning to you all. His Excellency Director of IIK Strada Kediri, Professor Dr. Sandu Sioto SKM MKes, the respectable to all the speakers, the honorable to all the Dean Faculty of IIK Strada Kediri, the honorable all participants of this symposium. Ladies and gentlemen, please introduce myself. I am Eva Agustina. Today, I will lead our symposium in this first session as a moderator. I am very pleased to see you all and welcome all of you to this event. Ladies and gentlemen, before we start our first session, first I would like to say something to all the participants. Here are the rules for participants in the online international conference today. Okay, on today, participants in the symposium should be arrived on time until it is finished. Oral presentation room is divided into 4 rooms. Participants can see the position of the room in the arrangement of this event. Participants can ask a question via chat Zoom column using English. So you can type your question in chat Zoom. Participants are required to fill out the list present on the process list to be shared by the committee. Participant certificate can be downloaded on the link that will be shared by the committee up to 1 week after the event. That's the rules to all the participants. Now we will start our first session. Before we start, first let me introduce to all the speakers. As our first speaker, Dr. Yu-Hsuan Chang. Good morning, Doctor. Yu-Hsuan.
Hi. Hello.
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 Good morning, Doctor. Good morning, Dr. Yu.
Good morning.
Yu-Hsuan. Today, Dr. Yu will presenting topic with the title National Health Insurance Information Technology to Combat the COVID-19. First, I will read the CV from Dr. Yu. Current affiliation of Dr. Yu. She is a Director, Planning Division, National Health Insurance Administration, Ministry of Health and Welfare. Adjunct Assistant Professor at National Taipei University of Nursing and Health Science. Educational background, PhD in Political Science, National Taiwan Normal University. EMHA National Taiwan University, MA in Political Science, National Taiwan University, BA in Law, also in National Taiwan University. And then for our second speaker, we have Dr. Shwu. Good morning, Dr. Shwu.
Hi, good morning. I'm here.
Yeah. Dr. Shwu also will present the topic about Taiwan National Health Insurance Information Technology to combat the COVID-19. Here is Dr. Shwu's CV, curriculum vitae. Dr. Shwu Wu, or should I call Dr. Teresa Wu?
Oh yeah, you know my name. Yeah, you can call me Teresa.
Okay. Maybe easier for me to call you Dr. Teresa. Okay. Okay. Dr. Teresa is a Director of Information and Management Division, National Health Insurance Administration, Ministry of Health and Welfare of Taiwan. Educational background. She is finishing her master major in computer science in State University of New York at Binghamton.
Yes.
And then Bachelor of Sociology in National Taiwan University. And her present appointment, right now, she is a Director of National Health Insurance Administration, Ministry of Health and Welfare, Taiwan. Her experience, she is a Senior Executive Officer of National Health Insurance Administration, Ministry of Health, Welfare, and in Taiwan. Deputy Director of Information Management Division of National Health Insurance Administration, also Ministry of Health and Welfare, Taiwan. Senior System Analyst of Information Management Division, National Health Insurance Administration, Ministry of Health and Welfare, Taiwan.
Yes.
Yeah. Deputy General Manager of Information Management. Senior Executive Specialist of Information Management Division, Bureau of National Health Insurance in Taiwan. Senior System Analyst and Section Chief of Information Management Division, Bureau of National Health Insurance, Taiwan. Section Chief of Information Management Division, Bureau of National Health Insurance, Taiwan. Deputy Section Chief of Information Department, Central Trust of China. Specialist of Information Department, Central Trust of China. Officer of Government Employees Insurance Department, Central Trust of China. Also as a social worker of Taipei City Government Social Affairs Bureau in Taiwan.
Thank you. So
Good morning, Dr. Teresa. As our third speaker, we have Mrs. Tzu-Yu Chen.
Yes.
Good morning, Dr. Shwu. Yeah. Okay, I will read the curriculum vitae of Dr. Shwu. Her educational background. She has her Master Science in Information System, University of Texas at Arlington. And then she is she is graduated from Department of Information Management in Tamkam University. Her experience, she is an associate researcher of Informational Management Division, National Health Insurance Administration, Ministry of Health and Welfare. Associate researcher of Information Management Division, Bureau of National Health Insurance, Department of Health, Executive Yuan. Associate researcher of Information Management Division, Bureau of National Health Insurance, and System Analyst of Galaxy Software Service Corporation. Good morning, Dr. Shwu.
Thank you.
Okay, before the presentation begin, let's know the regulation for our presentation. First, all the three speakers will present their topic for about 20 minutes. And then after all, the participant can preparing the question or send the question using chat in Zoom. Okay, now allow me to welcome our first speaker to start the presentation. Please, the Excellency Dr. Yu to deliver your presentation. Dr. Yu, please, you may have your time.
Okay. Good morning, ladies and gentlemen. I'm Yu-Hsuan Chang, Director of the Planning Division of National Health Insurance Administration of Taiwan. Today, my topic is application of ICT on Taiwan's NHI big data to combat COVID-19. I will give you an overview about Taiwan's health insurance system and share the experience of application of to combat COVID-19. Taiwan's national health insurance was established in 1995 to provide universal health coverage to citizens and the international residents. 99.9% of the population was covered. NHIA is a single-payer system which is run by the government. About 93% of healthcare providers have a contract with NHIA. Around 850 million medical records are filed to the NHI per year. Medical expenditures was about $25 billion in 2019. Around 70% of the healthcare system is dominated by the private sector. Hospitals adopt the cost-up model. We have no compulsory gatekeeper system. Thus, the accessibility to medical service is high. There is no waiting list as defined in Western countries. NHI provides comprehensive benefits that cover inpatient care, outpatient care, prescription drugs, dental service, traditional Chinese medicine, daycare for the mentally ill, and the home nursing care. Expensive health service such as MRI scans, dialysis, and organ transplants are all covered if medically required. The average utilization rate of NHI outpatient service in 2018 was around 15 visits per person per year. Those visits include visits for dental service and traditional Chinese medicine. The number of outpatient visits is much higher than many OECD countries. NHI adopt per payment system. NHIA reimburse providers mainly based on fee-for-service payment system. Global budget system is the key payment scheme adopted to control the growth of medical costs. As for quality improvement, the pay for performance, we call P4P, the system and the Taiwan version DRGs were implemented later. The NHI Smart Card is a certificate when seeking health service. It contains records of the patient's last 6 visits, drug prescriptions, allergies, and catastrophic disease, and so on. It can also trace and monitor the outbreak of infectious disease at the very beginning. Especially this year, the NHI Smart Card provides highly effective and efficient function in preventing the outbreak of COVID-19. According to the 3 dimensions to consider when moving towards universal health coverage, which is addressed by the WHO, The current status of the Taiwan's NHI is relatively good. Taiwan's NHI covers 99.9% of population, provide comprehensive benefit package, and the levies low cost sharing for inpatient care. One of the core values of Taiwan's NHI program is to remove financial barriers by having the rich subsidize the poor and the healthy subsidize the unhealthy. For less fortunate people, the government provides several types of assistance, such as premium subsidy, financial assistance for the poor, and the medical assistance for the disadvantaged. The NHI program has a good reputation among Taiwanese people, and is generally considered as one of the most popular public policy. According to the poll in 2019, the public satisfaction rate with the NHI program hits almost 90%, the best record since 1995. Facing the social and the environmental changes, such as low birth rate, decreased labor force, increased chronic disease, aging population, abuse of medical resources, and the increase of medical expenditures, NHI adopt patient-centered reform and innovative strategy through applying ICT and the AI technology on NHI big data. The application of big data concept include NHI medical system designed for the healthcare providers and My Health Plan designed for the insured. For the past years, NHIA has been integrating health data from government agencies and the medical providers on a single data platform for value-added application. The NHI medical system is aimed at reducing medication duplication and assuring drug safety. 12 items include the medication records, surgery records, examination records, dental service, Chinese medicine service, and so on. Patient utilization rate of medical system hit 86.5%, and the medical institution utilization rate are almost over 90%. The high percentage of utilization among medical professionals shows its function and the popularities. Digital information systems enable health data exchange and information sharing, and help healthcare professionals taking immediately measure effectively. To contain the COVID-19 outbreak, the NHIA used the medical system to further develop the real-time alert system by linking it with border entry and exit investigation data. Based on the relative symptom, the doctor could immediately discover the suspected case and took proper measures. On the other hand, the top 10 leading causes of death are cancers and the chronic disease. The objective of My Health Plan is to empower people to have a better self-care and live a healthier lifestyle. It provides 3 years of the personal medical data, including healthcare provider's name, dates of visit, diagnosis, medical orders, allergy histories, and so on. The apps allows personal health data be portable anywhere at any time. Since the COVID-19 outbreak in January this year, face masks were lacking globally. To ensure the face masks be equally distributed, a mass rationing plan was implemented in Taiwan. People can either buy ration masks at the NHI pharmacy or order them online. My health bank was interfacing with the government online mass purchasing system, which providing users a convenient way to order ration masks online. NHIA also released the update on the mass inventory of every single NHI pharmacy on the website. After 5 years promotion of my health bank, the system get more popular among the Taiwanese people. People can buy masks through the app. Number of the user increased rapidly to near 5 million people this year due to the COVID-19. With the big data concept and the cloud computing technology, the NHI has begun to apply artificial intelligence for deep learning of the past 25 years accumulated claim data warehouse for the development of precision medicine and the precise claim review to improve the healthcare quality. All the data was identified to protect personal privacy for industry application and academic use. This year, the AI technology is also applied to build pneumonia prediction model to combat COVID-19. The NHI is dedicated on the reform and the innovation by applying the ICT on NHI big data for providing people a better quality health care. Thank you very much.
Okay, thank you very much for the nice presentation from Dr. Yu. Dr. Yu, thank you very much for giving us such an informative and interesting presentation. And then we will continue to our second speaker. I would like to invite Dr. Huey to deliver the presentation.
Hi, good morning, ladies and gentlemen, and all
Good
our
morning,
friends.
Dr. Shwu.
Yeah. Okay, and just welcome all our friends from Indonesia, Thailand, Malaysia. It's very nice to have this opportunity to share with you our experience, how we combat COVID-19 using our NHI Medical system. I am Shwu Wu, or you can call me Teresa Wu. I am the Director of Information Management Division of NHIA in Taiwan. And from the introduction, you know that I worked for NHIA almost for 25 years. So, well, it's good to have this opportunity to share our experience here in Taiwan with all our friends nationwide. And this slide shows you the major function of NHI's information system are to handle the data flow of three major parties, including the insured, the healthcare providers, and the NHIA. The insured pay premium to NHIA and receive an NHI card as a insurance card. And when people need healthcare services, they can visit any healthcare providers and pay co-payment according to NHI's regulations. And the healthcare providers, they can upload patients' medical visit data daily and also send medical claim data to NHIA at the end of each month to get their payment reimbursed. And according to the regulations of medical benefit in NHIA, we should reimburse medical claims within 60 days after claim reception. And next slide shows you the network architecture of NHI information system. All the contract hospitals and clinics and pharmacies, they are linked together through NHI virtual private network. We call it VPN in brief, to do their daily data exchange and information sharing. And in addition, for the general public, they can access information related to NHI regulations, his or her own rights or healthcare issues, very comprehensive data content on NHI's website through internet. And in order to improve patient safety and at the same time to improve the effective usage of health insurance resources, the NHIA adopt cloud technology to build a health insurance from a cloud system in 2013. That is majorly handling the medicines information. But as year passed by and the policy changes, we upgrade the PharmaCloud system and add more and more content and upgrade to MediCloud system in 2015. Up to now, the system provides 11 types of medical information, such as medication, test results, or even medical images, etc., for physicians to inquiry. And since September 2018, MediCloud system has launched a new function to online alert or remind physicians of repeated prescriptions to ensure patients' medication safety and also to avoid unnecessary waste of repeated prescriptions. Also, through this information sharing platform, physicians can report the therapeutic not equivalent drugs or inferior quality of medical images. This platform helps both NHIA and the healthcare providers to communicate efficiently. So how to track potential infection cases require rapid data integration from various public and the private sectors. Taiwan quickly concatenate and integrate data from relevant agencies such as CDC, National Immigration Agency, Ministry of Health and Welfare, Civil Aviation Administration, and the Ministry of the Interior to track cases who have maybe travel history or contact history, occupation or cluster, or they require a further screening. NHIA's MediCloud system provide multiple channels, including API real-time connection with hospitals and clinics, so they can query relevant TOCC history information of the patient when they're seeking medical care. Through big data analysis, NHIA also combined internal medical visit data we have with external data to produce epidemic reports to our Central Epidemic Control Center, CECC, to assist their monitoring and tracing jobs. And this slide shows you that in order to prevent the spread of the COVID-19 epidemic, NHIA developed and added the TOCC query function within 1 day under the existing system architecture of Medicloud. In fact, we received the order on January 25th. That is Saturday night, very late at night. And then the system went online on January 27th, that is Monday, very early in the morning, 7 o'clock. So you know that all the development time is very short. Our IT people work very, very hard to try to let this function online as the order. And the doctor then can check the patient's travel history in the last 30 days on the screen. And according to the global development of the COVID-19 epidemic, our medical system increased the patient's travel history warning regions and the countries on rolling basis. For example, first, we alert that the traveler is from Wuhan city. And then the next day, we extend to the Hubei province, and then extend to other provinces in China, and then finally extend to other countries. So in addition to to checking the patient's TOCC related information on the screen, the doctor can also know the guidelines for the follow-up epidemic prevention measures, also can promptly remind the doctor to perform COVID-19 screening for this specific patient. So it is a very informative and a very promptly help for the doctors. And in order to allow all the general public to obtain masks fairly, NHIA also developed a mask control system in 3 days. This time, we received the order on February the 3rd, that is Monday night. And then the system went online on February the 6th, Thursday, early in the morning. That means our IT staff, you're working very, very, very hard to finish this job, okay? So the first stage of mask can only be purchased at pharmacies and health centers. That is the mask 1.0. And then the second stage, mask can be pre-ordered through the NHI app or on the eMask website. And then the mask can be picked up at any convenience store. And the third stage, mask can be pre-ordered and pick up at the convenience store. So for the general public, they are very easy to get their mask they need. So all this information about people buying masks is collected and managed in our centralized mask control system in NHIA. We just want to ensure that everyone can get masks fairly and conveniently. And because the developing time is so short for the system to go online, so the design of the screen must be very simple and easy for the pharmacist to input minimum data on the selling and the inventory screen. So they don't general people just insert their NHI card and the system will automatically bring out his ID number and his special flag for the mask purchasing. So generally speaking, the key measures to combat COVID-19 are as following. First, we prepare in advance, include our border control, establish the Central Epidemic Control Center in the very early stage. Also, we offer 19-2020 dedicated hotline for the citizens to ask any questions they have. And also, we hold press conference every day to explain the epidemic situation for our citizens to understand what is the current station right now. So people can obey the government advice to do anything to combat the COVID-19. And also quick response. For the physician, we can develop Medicloud TOCC function just in 1 day, right? And for information sharing across hospitals and clinics. Also for the general public, we develop mask distribution system in 3 days to ensure everyone can get mask fairly. And also we integrating of data across government agencies, including NHI's medical visit data, National Immigration Agency's inbound traveler, CDC's health declaration card for inbound traveler or confirmed cases, and the Ministry of the Interior for household registration and the possible contact person. So the efficient big data analysis to help CCC to control and monitor the epidemic situations very efficiently. Also, for the industry, mask and protective clothing productions, new drug development, etc. Everybody just work together to combat COVID-19. Last but not least, ensuring privacy and public health safety is very important. So personal data of confirmed or contact cases will not be disclosed. And only the authorized person can query the data for epidemic control and public safety. And all agencies has been asked to delete the epidemic-related data in 28 days since the epidemic is easing in Taiwan. Initiate information security audit operations to ensure people's privacy is not violated. So that is all I would like to share with you this morning. Thank you very much for your kind attention.
Thank you very much, Dr. Shwu, for your information. And we will welcome our last speaker for this session. We would like to invite Dr. Shwu to deliver the presentation.
Good morning. My name is Chen. I'm Associate Researcher of the Information Management Division of Taiwan's National Health Insurance Administration. Taiwan is one of the few nations to maintain the relative normal life during the pandemic. And my topic today is My Health Bank and how it applies to combat COVID-19. I'm going to share the system development of My Health Bank and share how it compares to the COVID-19. First, I'm introducing the background of the developing this system. Taiwan's national health insurance is a single-payer system. Our idea is to provide the insurance with these 3 features: accessible, equal, and efficient. In Taiwan, there are no gatekeeper system. The people have plenty choice to receive medical treatment with the great service of health insurance. So the satisfaction of the entire healthcare system up to 89.7% last year. This is a trend of the NHI financial status of the program was launched in 1995. The blue line stands for the revenue and the red line stands for the expenditure. The expenditure has been growing since the program first launched. Our health insurance administration is calculated in global budget, and we still control the budget below the 7% of Taiwan's GDP every year, although there's some accumulate surplus right now. We hope to provide a better tool to help people to care themselves. Aging, chronic disease, and high tech are three main reasons why the insurance program expenditure is increasing yearly. Aging is an unavoidable issue for all countries, and it becomes particularly hard for health insurance providers because it's getting more and more seriously. According to the research, Taiwan's aging population is growing quite fast compared with other countries. In 2017, the elder took about 14% of the population, and they used more than 37% of the NHI medical expenditure. It is estimated in 2035, more than 50% of the medical expenditure were taking care of the elder population. According to our data, more than 50% of the outpatient expenditure is for the chronic disease care. Taking care of the chronic disease patient has become an important issue when it comes to health insurance expenditure. As the technology improves, new medical equipment and drugs are introduced to the medical system. So it also caused the rise of the health insurance expenditure. This is the NHI framework. The yearly growing expenditure in health insurance is unavoidable. So we wish to provide high-tech like My Health Bank and the medical system to help people to take better care of themselves in order to lessen the expense in secondary and tertiary care. My Health Bank is for personal use as a healthcare management tool. We aim to encourage the people to take responsibility for their own health. Next, I'm going to introduce the development of My Health Bank system. We have collected lots of medical data from the healthcare providers and the insurance fee data from the people over the past years. And we wish to give back to the people by providing this data through our website and webs. And we hope when the people have a better understanding of their own health, they can take better care of themselves. This is a trend of My Health Bank system usage. We have been promoting My Health Bank system to the people since the program was launched in 2014. In the beginning, we only provided two categories of the data with download service. The people should apply the first and can access the download file only on the next day. Then we developed an app and upgrade the visualized aesthetics. In 2016, we launched the My Health Bank System 2.0. After that, we have been continuously improving the system with adding mobile authentication and the family management function to the system. We applied the mobile authentication function in our app successfully, and we can verify users' personal data online with all 5 telecom service companies in Taiwan. With this unique feature, My Health Bank system was the first choice when Taiwan's government hoped to develop the name-based face mask order system. As you can see the trend, the app users were about 1.6 million last year. After providing the mask order function, the users were up to 4.9 million users right now. Next, I will introduce the content of My Health Bank system. These are the services that the National Health Insurance provides in Taiwan. The coverage includes the disease, injury, and the child delivery. So these items are the main data we provide in My Health Bank for the people, including inpatient care, outpatient care, dental service, and home health care. Since our program was launched in 1995, we defined uploading format in the very beginning and encourage all the healthcare providers to computerize their clinic or hospital system. Therefore, they can give us the electronic data when they submit the monthly reimbursement data to us. We check the data strictly. The process is above, as you can see. There are more than 1,600 rules to check out the provided data. Therefore, we can make sure the quality of the claim data. With all of these steps, we can provide high quality data to my health bank system. Since 2003, each person has an NHI IC card in hand in Taiwan. With IC card promotion, healthcare providers re-engineered their information system, and they can upload the patient's medical visiting data within 24 hours under our request. Receiving data from healthcare provider immediately can assist us to measure disease better. We also manage academic disease like SARS, flu, and COVID-19. We also integrate the cross-agency health data in our system. The data you see on the right-hand side are the data we have collected from the healthcare provider directly. In the past, the data on the left-hand side were mailed to each patient individually, so it's hard to keep records. But now, with all the data online, it's easy for the people to access. All the data we have collected above enrich the NHI Medical System and the My Health Bank database. We have increased the value-added function to both systems individually. There are multiple ways to access My Health Bank. We provide web function and apps for the people to easily use. And these are the example of My Health Bank online pages. We can present the individual 3 years medical records, and we visualize the dental care service, disease distribution, surgical body parts, and medical image. We also provide a reminder function, disease risk prediction, and we also provide the physiological measurement records in our system. Since May 2019, we add the family management function to My Health Bank. And we also concerned about the security measure for the domestic violence victim when we provide the family management function. Although we provide a lot of information for the people, and it's not easy for most people to understand the medical information. So we open the data to the third party, like healthcare providers, to elevate healthcare management. Before we provide that, we launch a software development kit named SDK. This function will help to authorize users' health data to a trusted third-party app with these 2 steps. All over the world have to face the COVID-19. The medical masks are crucial resources during the epidemic prevention period. Our government decided to build up the name-based mask purchase mechanism in February. Since the pharmacists can access the medical system daily, we apply the same system structure and build up the name-based mask order system just within 3 days. Therefore, the pharmacists can operate the system very easily. In the beginning, the people can purchase masks by NHI card in the pharmacy. Because there is a sales quantity limitation for each pharmacy and the people has to wait online for a long time. This March, we promote the online pre-order service in My Health Bank system for those people who has no time to take a line. People can pick up the pre-order mask in the self-selection convenience stores. We also cooperate with convenience store to pre-order mask. Then the people can get the mask and pre-order the next round mask at the same time. In the effort to provide the citizens more channel to purchase masks and ease the burden on pharmacies, Right now, the public can purchase masks easily, and we hope the public can charge all masks. In our app, the user can search for the proper healthcare provider's location. Based on this idea, we also release the pharmacy mask sales data as an open data, which is updated every 3 minutes. In Taiwan, coding the mask map became the most popular hackathon event for the IT persons. More important, everyone can verify the data accuracy in the map when taking live. After that, we got more and more applications in our app, such as make the purchase order record function, query function, make the donation, and even though we provide the 3 voucher pre-order function in our system. Through the promotion of this system, we are able to ask the healthcare providers to provide accurate information because the people will get the feedback when the data is wrong. And through our system, doctor and the patient can talk about the medical history more easily. And we also very concerned about the personal privacy safety measure to prevent others to access. And we also provide the download function in our system. When people download files, we also remind the importance of keeping personal data in good use. Taiwan's government recognized that the general public are the crucial partner for the success of the pandemic control. We request the people to wear masks and keep social distance to prevent the community outbreak. I hope you can get some idea from my presentation. Thank you for your kind attention.
Thank you very much, Dr. Shwu.
Thank you.
We still have time before we start our discussion. Okay, remind to all the participants, don't forget to write your question in our chat room. Okay. Okay, we still have 3 minutes before we start our discussion. Please, to all the participants, write your question in our chat room. And don't forget to write your question and which speaker do you want to ask. Okay, we already have a question here. Okay, I would like to read first question from Mrs. Anis. She is going to ask to all the speaker. Her question is, what is the impact of COVID-19 in Taiwan, and how serious the Taiwan government to support the recovery from COVID-19, especially for people health? To all the three speakers, we already have our question here. For our first question is from Dr. Anis. What is the impact of COVID-19 in Taiwan, and who would like to answer first? From Dr. Teresa.
Okay, my health bank system is for personal use, and because in this March, and we provide mask order function in my health bank system. That's why lots of people would like to download our apps to use, and that's a very key important. That's very important to provide a channel for the people to buy the mask online, and because everyone is about 2 weeks for the people to buy the mask, and for each time one person only can buy 9 pieces of the mask for adult, and you only can carry one more IC card for your family to buy the mask. That's why I think there is no stock mask issue in Taiwan. Okay. Oh no. Okay. And then next I will invite Dr.
Okay, for the mask, because we have a name-based system, so every citizen or people just can get 9 masks for 2 weeks. So when you want to purchase more, if the day is still within the 14 days, then you cannot purchase any mask. So it is very fairly. And for the government, all the mask production industry, all the masks are controlled by the government. So there is no way to over purchase or to just holding the mask for the individual or for the industries, factories. And also for the home isolation or home quarantine cases, if they have some need to get medicines, they can either ask their relatives to take the medicine for them. But we have the checking system to know that this patient have certain kind of disease or chronic disease that the medical can query his previous medications data. And also, we have a local government staff. They can just daily even visit the quarantine patient cases, or if they have any medical need, they can just have a special protection mechanism to send these quarantine cases to hospitals for further prescription or treatment. And for general citizens, we have every day's conference for the media. So all the citizens can know that for each day, how many cases is identified after screening, and how many is already cured. So the information is quite transparency, so citizens can trust government to follow all the control measures delivered by either local government or central government. And what else should I answer? Oh. Okay.
Does all the citizens about your policy? Does all the citizens obey the rules? Or maybe you still have some citizens that breaking the rules?
Breaking the rule. When general citizens without any symptoms, they must wear mask whenever they want to take a train or any public transportations vehicles, they should wear mask. And when the people is crowded, everybody should wear mask. If somebody didn't obey, then he could not take the MRT or even have fine. Even got fined, yeah.
So maybe it's almost the same in here, mask problem.
Yeah, so everybody wear mask whenever they want to go out. Crowded area, everybody just wear mask, protect themselves and protect others. And our big data analysis can help to handle all the potential contact persons. So watch very carefully for any symptoms they may have. So the epidemic condition is right now is easing in Taiwan. So everybody feel comfortable that if we obey government policies and everybody safe. Yeah.
Yeah. Thank you so much for the explanation to all the speakers. We will continue to our second question to Dr. Teresa from Mrs. Fitis and Mr. Kapip. Does everyone have health insurance and who finances it? And then who developed health ICT of Taiwan? Is it the government or it developed by the hospital?
Mm-hmm. In Taiwan, every citizen, even foreign workers here, got national health insurance. So, so the coverage rate is 99.9, except some maybe travel abroad for a long time and didn't come back to Taiwan. So I can say that almost everybody here in Taiwan got national health insurance coverage first. And then who developed ICT? I think for the NHIA, we developed our in-house information system. And for the clinic and hospitals, they have their own customized need. So we just announced a unified medical claim format to let all the hospital and clinics to follow this standard format to submit their claim data to NHIA. And if a hospital, I think almost every hospital has their own IT people. So we just communicate with them to share what is the file format, what is the editing rule for each field. So everybody can just exchange data very freely and conveniently. And for the small clinics, we have software vendors. Right now it's almost more than 100 software vendors. And they also follow the unified medical claim format to submit their claim data to NHIA. So for us, once we announce the nationwide standard claim data format, we can just get all the hospital and clinics medical claim data very conveniently. And all the process has been computerized, so we can receive the data within 24 hours. That's why our system is efficient and the data is very valuable.
Thank you for the information, Dr. Teresa. And we have our last question. How to actually from the government, is it a must or volunteer?
A must or what? Could you repeat your question again? I cannot catch it completely. Pardon me?
Okay. Yeah. How to promote the importance of health insurance in your country? I know your
or could you type in, because your voice is not very complete, not clear for me. So could you just type it out so I can understand your question?
Okay, for our last question, how to promote the importance of health insurance in your country? Because from the data, almost all the citizens have health insurance.
I think for the national health insurance, it is mandatory for every citizen in Taiwan to participate this program. So I think by law, every citizen or foreign workers must participate this insurance program in Taiwan. So everybody's health issues will be covered in our national health insurance. If I understand your question. So if there is no further question, I really hope that the COVID-19 epidemic can quickly go away, so we can face each other face in face and to discuss in more detail later times.
Yeah, thank you very much.
Thank you. Okay.
Okay, I think that's all the question for today. So it's quiet. Yeah. It's really nice to have that the citizen is already aware about health insurance. Or maybe for the last suggestion for our country, maybe do you have a strategies or how to increase the awareness of our citizen about health insurance? Because in Indonesia, health insurance, it seems it's like a punishment for our citizens. So people do not have awareness about the importance of health insurance. Maybe do you have any suggestion?
Well, I think for us, it is by law that our government empower us to do so. So every citizen must join our national health insurance. For your country, I think maybe your government or cabinet members must have the awareness that the health is a universal value for the people in Indonesia or worldwide. So if they have the determination to do so, then maybe some communication with different parties or for the general people. They know that the insurance is very important, not only for themselves, but also for helping all the countries' peoples. They can help each other with the healthy, subsidized and healthy. So everybody can have a peaceful time or a casual life in your country. So it is the determination of your government to do so and give you the power, the law to just enforce it. And then I think it will be, in the long run, it will be no problem.
Okay.
Thank you.
Thank you so much, Dr. Teresa.
Thank you.
You and Dr. Shwu Chen for very informative and very interesting information about health insurance in your country. So we come to our conclusion. NHIA has been closely monitoring the COVID-19 situation for the home and especially for all the citizens in, in Taiwan. Okay, or maybe before we close our discussion, we should take a picture together. Okay, okay, I will take the picture for you. We'll start to count. 1, 2, 3. Okay, thank you. And
Okay,
maybe for our last picture, we have a very special Dr. Teresa, Dr. Su. Please, one more picture.
One more picture. Wow.
And maybe would you like to cross your hand like this? Would you like to cross your hand like this? Like a symbol in our campus.
Your hand like this, like
Put your hand like this. Put your arm like this.
哎，他那个可以看到对方的画面，对方的画面，对方的画面。
Excuse me.
可以啦。
Dr. Teresa. Can you follow my move?
Just moment.
Suara aku nggak kedengeran ya kayaknya.
对方。
Okay. Can you follow my move? I put my hand like this, and we take a picture together.
对方圈在
Okay.
好笑。
Okay, last picture.
没有看到，看不到。你要看对方的画面。
Yeah. Thank you.
跟自己要过来一点。好，这样可以吗？我们3家。
Now we will come to our last part from this session.
我们现在是要看镜头，还是要看
看
镜头。
Please, Technology Committee, share the certificate from the 3 speakers symbolically. First certificate is verified to Dr. Tzu-Yu Chen. Thank you so much for being our keynote speaker for today. And then our second certificate given to Dr. Huey. Thank you so much for being our keynote speaker. And for the last certificate given to Dr. Yu-Hsuan Chang. We are from Strada Kediri Institute. Very grateful because you join us in our event. Hopefully, this topic will be beneficial for all of us. Thank you. Please give applause for the speaker and for all of you, the participants.
Thank you. Bye-bye.
Thank you so much, Dr. Su. I will end this session. Thank you for the attention. Wassalamualaikum warahmatullahi wabarakatuh. Good morning.
Okay. Thank you for all the speaker, and also thank you to Mrs. Eva Agustina Yalistiarini as Nurse MGUP, who has been conducted the session and also the discussion. And now we have a break for 5 minutes, and we will continue for the second symposium after the break.